Hello, I'm Charles Moore. I'm an ophthalmologist specializing in refractive surgery, live in Houston, Texas, and we're going to try to answer some questions today that are most commonly asked by patients wondering if they're candidates for laser vision correction.
My name is Rayhan Ahmed. I'm an ophthalmologist based in Houston, Texas, and we're going to review common issues that come up that patients often will ask us about. And the first question is what is the recovery time for LASIK? So, Dr. Moore, if you want to speak to that.
Recovery time normally is about 4 hours. Most people go home and keep their eyes closed and put tears in and start their antibodies that night. And a huge percentage, 99%, return to work the next day. I know I've been a patient also, besides doing the procedure over 30,000 times. And I came back the next morning and saw patients who played golf that afternoon. So it's a very quick recovery. And the next question is safety.
Uh, so that is the main question I think patients come in, and that's the main concern. The short answer is yes, it's safe. What I tell patients, the new thing about LASIK is that it's old and it's been around for some time. We have long-term studies and data to show that it is safe with very high satisfaction scores. The technology we use now with the excimer laser and creating the flap with the laser is incredibly safe, and patients do extraordinarily well. The most important thing is to make sure whether the patient's a good candidate or not, and that comes in with all the preoperative testing, which we're going to talk about. A common question that comes up: what's the difference between LASIK and PRK?
Alphabet soup. But LASIK is basically done underneath the flap so that the eye doesn't really know that much has been done to it. Consequently, very little pain, very rapid healing time, very predictable responses to the laser energy. PRK was the original procedure that we first did when lasers were approved, and we were doing our work actually on the surface of the eye. So there's a little more discomfort and longer healing time.
Oftentimes, patients will ask whether LASIK is permanent, and the answer is yes. The surface treatment that we do that day is a permanent treatment. What oftentimes should be talked about with the patient is that the eyes themselves aren't permanent. They can change with time. For instance, the lens inside the eye can change with time and form a cataract. But the answer is yes, LASIK is permanent. But tissues sometimes often want to go back to where they were. And so there can be options for doing enhancements. But LASIK is a permanent procedure, and it's thought to be that. I don't know if you want to add anything to that, Dr. Moore.
Only the thing that one of the causes of a few people that develop changes years after their LASIK is a dry eye problem that they can't feel, because all of us this day and time use iPhones, iPads, computers. We're on digital devices half our lives, and these cut the blink rate by 40% and create a dry eye problem that the patient doesn't feel, but the eye, to protect itself, lays down cells. And that brings back a little creepy nearsightedness or astigmatism that patients often mistake for a change in their eye rather than what they're having to do with their lifestyle. Mm. And the next one is, you want to talk a little bit about side effects?
Yeah, that's a great question. Immediately after the procedure, patients can have dryness and the sensation that there's almost like a grain of sand in their eye, some grittiness. But that oftentimes goes away pretty quickly. And certainly dry eye is something we pay very close attention to before the procedure, and it may need to be managed with artificial lubricants and other types of drops after the procedure. Other side effects like glare and halos are certainly can be common shortly, but oftentimes patients will find them less noticeable with time. And this is where the preoperative counseling comes in very important.
That's a great answer. And how about patients over 40?
Um, The answer is really that it depends on the individual circumstances. There certainly can be candidates, and many patients we do are over 40. I think having a good preoperative testing to see what the patient's desires are, what they expect from surgery, where they want their vision to be, is the most important question. There are we do other things other than LASIK, including refractive lens exchange. Those are options too as patients get older. But LASIK is certainly one of the main options that we can do for patients who are over 40 and wanting to have better vision.
From a personal standpoint, once again, I had my LASIK when I was over 50, and I chose to have the LASIK. But it's a beautiful procedure, and there are many alternatives that will be presented to people, and that's the purpose for coming in for a free consult, to find out what your options are, what the choices are, and then you'll make a happier decision.
Yeah, definitely agree. A question that comes up from patients often is, does LASIK correct astigmatism?
When we first started doing laser vision correction, the only thing we could correct was nearsightedness. And today, with the modern day lasers and technology, we can correct nearsightedness, farsightedness, astigmatism, up to certain parameters, obviously. But that's the reason for having a consult, because 99% of the people walking around with glasses and contact lenses are good candidates to have laser vision correction, despite what they may have been told in another office.
Oh, definitely true, yeah.
How about hurting? Does LASIK hurt?
That is, out of all these questions, I think that's another very common question. Patients may experience, the answer is no. LASIK does not hurt. They may experience sensations of pressure during the procedure, something as if there's something inside their eye, again, grittiness. But we give patients preoperative drops, numbing drops during the procedure. And if patients request, we can give them oral sedation medications to sort of take the edge off a little bit prior to doing the procedure. And patients routinely denied having any significant discomfort during the procedure. Pressure, more than anything else, it is a quick, very easy procedure from the patient's standpoint. But perhaps, Dr. Moore, since you've had this done, you could probably talk to it personally.
Well said. I'm the biggest coward in the world, and there's no pain involved with it. Most of the time, people will think they're having pain because of fear factor. And so it's our job at our clinic to get rid of the fear factor, and that gets rid of most of the pain issues.
So after all these questions, if someone's interested, how would they know if they're a candidate or not, Dr. Moore?
The only way to know is to come in and have a real good evaluation by a doctor who's involved in doing the procedures all the time, and find out what they're a candidate for and what they're not a candidate for.
Well, those are all the questions. Thank you so much. And certainly if you out there have any further questions, please contact our office, and we look forward to seeing you soon.
Quería avisarles que nosotros, muchos doctores y empleados, hablamos español, y con todo gusto, si prefieren preguntar estas cosas al doctor o enfermera que puedan contestarle en español, con todo gusto le ayudamos. Gracias.